Next, from the state capitol, we talk with a representative of the American Lung Association of Illinois. We hear about proposed legislation that would prohibit smoking outside on college campuses, as well as other proposed restrictions. This runs about 10 minutes.
Kathy Drea with the American Lung Association. Thanks for joining us on the Illinois Channel. Tell us, what are some of the issues that you are advocating for this year in the Illinois State Legislature?
Our number one priority is Senate Bill 2202. It's smoke-free college campuses. Last year it passed the Senate. It got over to the House too late. So we just passed out of House Higher Education Committee last week, and we're working the entire House now.
And because this is the same legislature, you don't have to go back through the Senate. You can just bring it over to the House, and then once that passed, it would go on to the governor?
Actually, we do have to go back to the Senate because we had to put in an amendment to change the dates, the effective dates.
What would the bill do?
It would make all college campus property smoke-free.
And that would include whether it's a community college or four-year college or anything like that?
Right, all publics.
Now, I just saw a report that down in Southern Illinois University, I don't know if I guess they're doing this on their own, that they allowed people to be smoking out in the parking lot, I think. Would your bill preclude even that?
Yes, parking lots would be smoke-free.
What would you say to those who say, we're trying to give up smoking, but in the meantime, to feed our habit or something, at least we're outside, we're not hurting others?
This is just an extension of the bill that passed in 1994 to make all secondary and elementary schools, public schools in Illinois, smoke-free. And actually, at that time, teachers smoked inside in the teachers' lounges, and so that was a big deal back in 1994. The students are already used to smoke-free campuses when they move to college, and we just think it's the right thing to do. That particular age group, 18 to 25, has the highest smoking prevalence rate of any age group.
And where do we stand right now, just in general? Let's go back and do a little bit of an overview. Where can people smoke currently, not irrespective of college campuses, just in general? Is it anywhere outside?
You can't smoke within 15 feet of any public building.
And public meaning any place like a bar, or do you mean like a state-owned?
Any kind of a bar, restaurant, any kind of a workplace, or a government building.
Are we seeing any, and maybe it's too early to tell, are we seeing any health advantages thus far from the prohibitions against smoking inside that Illinois has passed, I forget how many years ago it was now, but is there any evidence that we're gaining as far as health results?
It is too early for many aspects, but we have had reports that there are fewer heart attacks in the emergency rooms in Illinois.
And what year was it that Illinois prohibited smoking indoors?
It took effect January 1, 2008, so it's been 6 years.
6 years, all right. I know a lot of the bars at that time said it would really hurt them. Has there been any follow-up studies to see to what extent it has impacted any businesses one way or the other?
We did several impact studies within the first 2 or 3 years. I know within 3 years there were actually more bars that were open in Illinois than there were before Smoke-Free Illinois passed, and revenue had also gone up. So,
now, one of the other issues, and it's, we think, of course, you as smoking, and there's a number of lung-related issues that I guess you would become involved in. One is radon and the testing. To what extent are you involved in that, and where do we just stand, and give us a general overview?
2 years ago, we passed 2 radon bills. One would require all new homes built in Illinois to have a passive radon system built in when the house was being built. That was Representative Emily McCasey's bill. And the other one required all daycares to test for radon, and they would only have to do it once every 3 years when they renewed their license.
And just for those who've forgotten, what is radon and how bad is it for us?
Radon is a colorless, odorless gas that is in all buildings that we have. Some states are worse than others. Iowa has a very high concentration of radon. Illinois, in certain areas, has a very high concentration of radon. You don't know if you have radon in your home or in your workplace unless you test, though. It is colorless and odorless.
And what impact does it have on people?
It causes lung cancer.
And I'm kind of curious, we're standing here in this basement of the state capitol. Has the state capitol ever been tested? Do we know if there's radon gas here?
I don't know.
Be something to find out. Are there any other issues aside from the cigarette smoking on campuses that you're following right now?
We're also working a bill to prohibit smoking in cars with minors, and that is being heard in Senate Public Health Committee.
And minors, so anyone under the age of 18, or are we doing 10 and below?
Anyone under the age of 18.
And again, what would you say about those who say, you know, we're not hurting anyone else, this is our own family, and at what point does government stop its intrusiveness? How do you respond to that?
You know, the American Lung Association has always advocated for those who don't have a voice here. When we worked on Smoke-Free Illinois, we worked to protect workers, people in the workplace who didn't have a voice. In this instance, we're working to protect children. Vehicles are a small, confined space. You could have one or two or even more smokers in a car with a child, and it can cause SIDS, sudden infant death syndrome. It can cause upper and lower respiratory problems, bronchitis, pneumonia, middle ear infections, and middle ear infections are the cause of the most childhood surgeries. Also, future problems with cancer or heart disease. So there's lots of things to consider. And over the years, I've received many calls from people who are concerned about maybe grandma taking their children in the car and smoking, or maybe a divorced parent, or, I've heard all the different scenarios. And, what can I do? And if it's not a law, there's really not much that they can do to prevent it from happening.
One last question. I would say asthma is something that there was apparently a large increase in asthma cases over the last 10 to 15 years. Do we know what has accounted for that? Was it just better testing? Is it something that was actually affirmatively causing more asthma, or are we still lost on that?
I think that we don't know the answer to that. I do think part of it is testing, and I think that the medications that are available now, we've seen a lot of people be able to keep their asthma under control better than they were able to in the past.
And as far as the American Lung Association, if people want to get more information, I guess they can go to your website for whatever of these issues or others that they might be interested in following?
Right, lungil.org. You can also, of course, I always have to put in a plug for the Illinois Tobacco Quit line, which is at our office, and that number is 866-QUIT-YES. And last year we answered 85,000 calls at our office to help people quit smoking in Illinois.
Some of the things what kind of things would you tell them that could help?
The counselors, people always think that they can't quit. They've always, they've tried everything. And that's who these counselors deal with. They work with people who have tried everything. They will talk to you about what you have tried and what worked maybe for a while. And, they will try to find something that will help you. And every time you call, even if you don't get the same counselor, each counselor keeps nurses' notes, and so you don't have to start your story over from the beginning every time. And there's no limit on the number of times that you can call, and there's no time limit. In many states, there are time limits, and you can only call once, or you can only call 3 times, or whatever, but not in Illinois. There's no limit.
This is an unfair question, and I shouldn't have wrote it, but maybe you know off the top of your head, maybe you don't. If we look back over 50 years or so, over some prolonged period of time, do we know, how have the rate of smoking as a general population? I'm going to guess it has gone down, but do you actually know any kind of numbers off the top of your head?
Sure. Actually, in January, we just celebrated the 50th anniversary of the first Surgeon General's report that came out in 1964. And at that time, in 1964, about 40% of the population smoked. And now, nationwide, it's about 18%.
That's quite a drop.
It is. But it's not enough. We still have work to do.
All right, Kathy Drea, thanks for joining us.
Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.